My name is Scott Filler. I am the head of malaria at the Global Fund to fight AIDS, tuberculosis, and malaria. Temperature changes, shifting rainfall patterns, and extreme weather events are affecting the spread of malaria. In the countries where we invest, we have observed a sharp increase in malaria cases after extreme weather events, including cyclones and flooding, as in Pakistan, Malawi, and Mozambique. Climate change is also affecting the geographical spread of malaria. Malaria-carrying mosquitoes are appearing in places where they were not previously found, like in the highlands of Ethiopia and Kenya. This not only threatens previously unexposed populations to malaria, but increases the malaria risk for those most vulnerable. Adding to this threat is an invasion of an urban malaria mosquito across eastern and western Africa, which breeds all year round and shows an alarming resistance to most insecticides. Communities least responsible for climate change are the ones most impacted by it, like the villagers from the Sindh province in Pakistan, who had to evacuate their homes during the massive floods of 2022. After they returned to rebuild their lives, they faced a peak in cases of malaria, including a higher proportion of the more dangerous form of malaria that's not typically found in Pakistan. Most people who die of malaria are unfortunately children under 5. The Global Fund supports countries that are most vulnerable to the impacts of climate change. In the short term, we are providing emergency funding to support countries to respond to climate disasters, including to cover life-saving necessities such as mosquito nets, medicines, and water sterilization tabs. In the longer term, we are supporting countries to strengthen their health systems and make them more resilient to climate change. For instance, we support countries to digitize their health systems and health records so they are not lost when a climate disaster hits. And we invest in community health workers to reach the people in the most remote locations.